Hi, I'm Dr. Gordon. I teach manipulation under anesthesia all over the country and have been involved in MUA since 1985. I have with me today Dr. Adam Rosoff, Dr. Brian Wolstein, Dr. David Wolstein, and Dr. Kevin Burrell. And what I wanted to do for a long time is to kind of have a round-robin discussion with a group of physicians who are involved in MUA, and I couldn't pick a better group. This group in total, with all the procedures we've done, probably done somewhere in the neighborhood of 10,000 procedures. So we've all had exposure, a great deal of exposure to procedures that are helping patients every single day. And we've seen some phenomenal things happen. And when I teach the classes and I talk to the doctors about MUA and what they're going to be able to offer their patients, it's extremely hard for me to describe what really happens as far as outcomes are concerned until they actually take part in the procedure and actually see the difference between the patients prior to having MUA and when they're completed with MUA. And it's a remarkable thing, and I talk a lot about that quite often. I got involved in MUA because I needed something to offer my patients that continued to need manipulation but really weren't responding as well in the office as I'd like to have them respond. They were kind of minimally improving, but they really weren't candidates to be referred for surgery. Most of them have had injection therapy and that kind of stuff, but you know, it really wasn't working for them. And so we started doing manipulation under anesthesia, which is an old osteopathic technique. And it was really remarkable once we started doing it that we actually had now something to offer. Dr. Dave Wolstein is a medical physician. He's our attending physician, and we've always known from the very beginning that manipulation under anesthesia was a team approach. It takes a combination of medical physicians, DCs, DOs to put this program together to offer the service to the patients. And so what I thought we would do today is just talk a little bit about some of the remarkable things that we've seen, some of the ideas behind MUA, and how it's really kind of come to the forefront, because it really is something that is well defined and well offered now to the general public, even though a lot of patients still don't know anything about it. And you know, Brian, we've talked a lot about the fact that the patients just don't understand, you know, that this is out there and that it's available to them. And you treat a lot of sports athletes, and they're getting some phenomenal results.
Yeah, that's true. I've been part of thousands of procedures after treating patients for over 20 years in general practice, and still having a lot of those patients, you know, for years and years and years that keep coming back. They may get some results. They may feel better for a couple of weeks, maybe a month, but it keeps coming back. Those patients tend to do very well. Patients that have tried chiropractic, physical therapy, that are taking pain meds but still have issues respond very well to the procedure. And one of the biggest reasons is it puts a patient in a state where they're totally relaxed. A lot of times in the office setting, when you try to adjust a patient or stretch them, they'll get a lot of resistance because it's painful. Or a lot of people that have injuries, whether it's maybe a disc injury or a small tear in the rotator cuff, injuries like that, they're scared because they know they have an injury, so they'll resist you when you try to do things to help get them better. But under the state of you know, twilight anesthesia, they're relaxed. They allow us to break up the scar tissue adhesions that are there, restore mobility and function in the joints as well as in the spine, and they end up having a lot less pain, and now they can exercise and do rehab in the office setting, and they tend to get much better very quickly.
One of the things I was we kind of found a resistance in a way initially when we first started doing this procedure as doctors of chiropractic, where some of our medical colleagues didn't really understand what it was we were doing. It's not that they were resisting it, it's just that they didn't understand it. And Dave, Dr. Wolstein, is a medical physician who's taken my training, and it was quite eye-opening, to say the least, when we took the training. You know, and from your perspective, from a medical physician, you know, maybe you can give a little bit of information in the background of you know, how you how you got involved in doing this.
Just my background is that I'm board certified in nuclear medicine and radiology, and involved with the American Academy of Anti-Aging, where I see patients frequently for hormone imbalance. Dr. Bryan's my son, and I got involved with sort of dubious. I'm an old-time physician. Dr. Gordon mentioned that patients don't know about this, don't understand it. Well, physicians don't understand it. So when I came into it, I did it primarily because my son was doing it and needed a physician, and I work up the patients, make sure they're medically okayed for it. And if I had to say 2 words about it, all I can say, it works. Okay, I've seen cases that MDs would say almost miracles, and Dr. Adam has one patient he's going to talk about. But even today, the last patient I saw today, Dr. Burroughs' patient, I asked her today how she felt. Today's the 2nd day of the 3rd day. And she said to me, it's the first night I've slept completely in a few years. And I would say today when the patients check out, and most of them I see, almost all of them, if not all of them, feel better. And this is only the 2nd day that we're doing it.
And Dr. Kevin, we've kicked around the idea of you know, patients' responses after the procedure that we've heard, I don't know, countless of times. And again, it goes back to us trying to describe, without the people that are looking at this knowing what we're talking about, but give the patients, give the people a picture of what it is that you see. And he used the word miracle. It's not a miracle, but it's just amazing that the patient's you know, response.
That's true. The results are rather amazing in a sense that it's a life-changing experience for some people. We see a broad spectrum of results. Some have significant improvement. Some have just massive improvement. One particular case that always comes to mind for me is an individual who had chronic low back pain for over 1.5 years. And this was a very fit man. He had tried every other component of healthcare. He didn't really get too far with the progress in chiropractic. He'd been in pain management. He had epidural steroid injections with very little results, or at least temporary results. And he was directed to the surgeon. This was kind of his last, I guess, approach to try to resolve his issues in his lower back. And we brought MUA to him as an option. And after day 1, it was rather amazing. He got up off the table and he said, "This is a miracle. I feel absolutely wonderful," and absolutely walked out of the facility on his own. Prior to that, he was on crutches. He would have to sleep on the floor. He couldn't sit for more than 3 or 4 minutes. In fact, his wife would have to drive him around in the back of their SUV, in which he set up as a little apartment. So for him, a very significant change in his lifestyle. It just basically turned his whole lifestyle around to where he could actually function properly again. Now, is everybody like that? No. However, all the results that we've seen over all these cases that have been mentioned have been very positive. A lot of it has to do with the patient as well. As long as they follow the protocols and do the physical therapy rehabilitation after the procedure, most of them do very, very well.
That's a significant you know, point to bring up, Kevin, is how important the post-care is, because we can do really remarkable things for 3 days, but if the patients don't follow the post-care and the rehab, you know, they really don't get over their problem. One of the things that, you know, in general that should be mentioned is how simple this really is as far as a layman's perspective of what it is we're really doing.